All surgeries have potential risks and complications. We always weigh the potential risks versus the potential benefits to try and figure out what's best for a patient. In carpal tunnel surgery, the potential benefits are gigantic. The potential risks are very small, thus great outcomes with carpal tunnel syndrome. But the risks include a small risk of bleeding. It's not so much bleeding out during the operation, but it's really if you have a small hematoma after surgery that can compress the nerve. What a hematoma is a minor complication from surgery due to a small amount of bleeding. Now that bleeding may cause pressure of surrounding structures, and since nerves are very compressible, they can be affected by even a small hematoma or blood clot. It's very similar to a blood clot. There's a risk of an infection, which is less than 1% of the time, but it's your hand. And the risk of infection is more due to you than it does to me, because it depends where you're putting your hand after surgery. You got to keep your wound clean and dry, very important. Other risks include me damaging the nerve. I could damage the sensory component, or I can damage the motor component. So it can cause permanent numbness in your hand, or it can cause permanent weakness of your hand, and or both. I've never caused anyone to have increased weakness or numbness after this surgery. This covers the grand majority of potential risks of the surgery. There are other much smaller risk items, for example, injuring tendons or painful issues from damaging small sensory branches in the hand. We've pretty much covered most of the complications, and it's a very low risk operation.